Did you know that oral sex carries risks most people don't talk about? Many patients assume it's completely safe, or don't realize it's still considered a form of sexual activity. But the truth is, this practice can expose you to several serious health concerns if you're not careful. Stay with me until the end of this video, and I'll walk you through the key diseases and risks you need to be aware of, based on medical research and real patient cases. Hello everyone, I'm Laura, and welcome back to the Men's Health Channel, where we talk openly and honestly about the issues that matter most to your well-being. Many patients, when questioned by doctors about the frequency of their sex life of sexual intercourse, do not consider the practice of oral sex as an exposure. However, this is a misconception. The practice of oral sex can indeed pose risks and dangers often unknown to those who engage in it. Before we discuss and identify the 5 main diseases that can be associated with the practice of oral sex, let's clarify that the oral cavity, the mouth, and the oropharynx are environments with a polybacterial flora, meaning there are bacteria that normally colonize our oral cavity. They are associated with the digestion process with our digestive system. Under normal conditions, they do not hyperproliferate. They maintain a normal flora in their usual numbers. However, in pathological situations when diseases occur, these bacteria can hyperproliferate, and even the emergence of new germs that are not typical of the oral cavity can appear, such as the herpes virus or HPV. These pathogens are indeed associated with the onset of diseases. Furthermore, we need to remember that the urethra, which is the urinary tract that connects the bladder and transports urine to the outside, is a sterile environment, meaning it is free from bacteria and other germs or fungi, and it can indeed be contaminated through this practice. By the way, speaking of risks to men's intimate health, if you are a man over 40, pay attention. There is a simple 7-second natural method that has been attracting the attention of urologists in the USA, and it can help with prostate health, male performance, and even rigidity during sex. If you want to know what this method is, point your cell phone camera at the QR code here on the screen now, or click on the link pinned in the comments. Now, let's continue. Here are the 5 main diseases that can arise from this practice. First, HPV, the human papilloma virus. As we know, there are more than 200 subtypes of the HPV virus. Some of them are related to the emergence of oropharyngeal cancer and penile cancer, as well as cervical cancer in women. Additionally, these viruses can also be associated with the appearance of benign lesions, such as genital warts. An HPV lesion in the oral cavity can go unnoticed and indeed pose an increased risk for the patient undergoing unprotected oral sex, and it can be a risk factor for the appearance of ulcers or even malignant diseases like penile cancer. Second disease, oral candidiasis, commonly known as thrush, or oral monolysis. It is a disease caused by a fungal infection which can often be transmitted from the contaminated oral cavity, infecting the glands, the foreskin, and the urethra, leading to a condition of balanitis or balanopostitis. These fungal infections are characterized by local discomfort, redness, peeling, and burning in the penile region, and their treatment requires antifungals, corticosteroids, or even some topical antibiotics. Third disease, herpes. Here we have 2 types of herpes viruses that have tropism, a preference for the labial and genital mucosa. Herpes simplex virus type 1 and herpes simplex virus type 2. These viruses do not normally colonize the oral cavity. However, a patient with a labial herpes lesion can indeed transmit a genital lesion to another patient through the practice of oral sex. Fourth disease, and this one is fortunately rarer, is syphilis. Syphilis is a bacterial disease that is rarely transmitted through the practice of oral sex. However, it can happen. In fact, the syphilis ulcer is very characteristic, forming a single painless ulcer on the glands or foreskin with raised edges and a firm base, which we can classically diagnose at first glance. It needs to be treated because it is a highly contagious disease. Fifth diseases are urethritis. Urethritis are inflammations in the urethra. They are classic conditions characterized by the appearance of redness, discomfort, and urethral discharge. Under normal conditions, as I said, the urethra is sterile. It does not contain bacteria. The two main germs that can cause urethritis are chlamydia and gonorrhea. However, they will need a vector for transmission, and it can indeed be associated with unprotected oral sex. But what are the ways to reduce these risks? Folks, the main ways to reduce exposure to the risks of oral sex are by reducing promiscuity, reducing the number of partners, and primarily knowing your partner. If this is not possible, always prefer the practice with the use of condoms. It is not common, for example, to share a toothbrush with a stranger. However, some people consider this practice common, but it should indeed be done with responsibility and safety, which is the practice of oral sex. And now, out of curiosity, comment below if you were aware of such exposure, what the dangers related to this practice were, or if this was new information for you. If you found the content of this video interesting, if you think it will help someone you know, share this information. Don't forget to subscribe to the channel, activate our notifications, and stay updated on our weekly content. A hug.